Well, hello, everybody. Welcome to this session for a virtual career event. We have a special guest today, and you guys will be able to hear more from him. His name is Simon, and he is a medical student from the Medical College of Wisconsin, and he will be talking about his experience with you. So I am so excited that we have a few people who are interested in this, and feel free, students, if you want to ask him questions, feel free. He said he's welcome to, he'll welcome any questions in the chat, and anytime just stop him and I can moderate your questions for him, and then we can answer any questions that you might have. Or if you want to wait till the very end to ask questions, you're also welcome to do that. Again, I want to introduce myself. By the way, my name is Mary Matiska, and I am with Inspire Sheboygan County. So welcome. First of all, we'll go ahead and ask a few questions for Simon. First of all, how about if you introduce yourself and your role and just kind of share your journey with us, Simon?
Yeah, sure. Thank you so much. So my name is Simon. I'm a first-year medical student, so we call it M1 at the Medical College of Wisconsin, which is in Wauwatosa, Wisconsin, so just outside of Milwaukee. We're part of like the main medical campus for the Milwaukee area. So if you guys have been to Froedtert Hospital, that's our main teaching hospital, and also like the big children's hospital that's there, that's all affiliated with our school. So yeah, I can run through a little bit about myself and my journey to med school and just kind of what being a doctor looks like in general. And I'll try to run through stuff quick. And if you guys have questions at any point, like she said, just feel free to stop me and ask the questions, and also have some time at the end. And also, if you've got any questions after this too, I'll put my email at the end so you guys can email me with anything else.
Awesome.
So yeah, just really quickly, I'll go through just a little bit about me, my experience, and then just a little bit about the med school experience more generally. So I'm from Minneapolis originally, which is where I was born and grew up and went to high school. So unfortunately, I am a Vikings fan, but I came to Wisconsin first to attend UW-Madison for college. And then after I graduated at UW, I ended up going on to study at the University of Wisconsin, HPV. So I actually worked in a basic science research lab for 3 years before I started med school. And that was in large part just because when I graduated college, I wasn't really sure exactly what I wanted to do. And that's totally normal for a lot of people. It might not seem like it now, but you guys will realize by the time you get close to graduating college, a lot of people don't know what they want to do. And some people, a lot of my classmates knew all the way through from the time they were young that they wanted to be a doctor. I would say for me, I knew from a pretty young age that medicine was something I was interested in, but I actually had some experiences doing some volunteering and stuff in college that made me think, maybe this is not actually where my main interests lie. Maybe this is not for me. So I wanted to be sure that if it was going to be something I wanted to do, that I took some time. So when I graduated, I worked in that HPV lab doing kind of more like bench type research. So like, pipettes and working with mice and stuff like that, not working with any human patients at all. But during that time, I also had a chance to explore some more clinical opportunities, some volunteering stuff. And it was during that time that I really realized that at the end of the day, I was interested in pursuing medicine, because at the end of the day, I realized what I really liked the most was having that in-person interaction with people, being able to work with patients, their families, and being able to make their real direct impact. So that's why I decided to apply to medical school. And then this year, I was accepted to the Medical College of Wisconsin, and that's where I am now. So I'm a first-year student. I'm almost done with my first semester. And basically what I'm doing right now, and I can talk about this more later if you guys have questions, but for most medical schools, how it works is your first 2 years are what they call preclinical. So it's more classroom-based learning like you guys are used to, and like you'll have more for like your lectures in college. And we have things like anatomy lab and stuff like that. But most of our learning is classroom-based, although we do have a lot of like case-based discussions. So it's not all just lecture, but a lot of it's just like learning the material. And then when you get into your third and fourth years, that's when you don't really have classes like you guys would normally think of classes. Instead, what you do is you have clinical rotations. So during those third and fourth years, you're in the clinic every day, and you rotate between the different services, the different specialties. So when you're on surgery, you'll report every morning to the surgery, the operating room, the surgery team, and you'll work with the doctor, the residents there. And at that same time, you're learning about it. So it's really only the first few years of medical school that are really more like traditional school, I guess. And then the second 2 years, you do have exams and stuff, and there's obviously a lot to learn, but it's kind of more practical learning. So that's kind of cool. And then just talking a little bit about what doctors do. Don't need to go into this too much because the nice thing about medicine is everybody kind of knows what a doctor does, right? Everybody here has been to a doctor at some point, but depending on what type of doctor you are, what your actual role is like can be pretty different. And I broke this down in a couple different ways here. If you guys have any specific questions about that, I'm happy to answer them. But basically, the main takeaway is just that everybody goes through medical school, everybody goes through residency, and there are a lot of things that are in common that all doctors who are seeing patients do. But within that, you've got a lot of opportunities to set up your life in different ways based on what you want. So if you want to work mostly, if you want to be a surgeon, you can be a surgeon. If you want to be not a, if you just want to prescribe medicine, see people in the clinic, you can do that. You can work in a big hospital, small hospital, in an academic setting. You can start your own practice. So depending on the choices you make about what you want your life to look like and what your priorities are, your day-to-day life can look really, really different. So that's one thing that's cool about medicine is there's, even after you start it, there's a lot of flexibility once you're established in practice.
Yeah, that's awesome.
I'll talk a little bit about salary because that's one of the things that was mentioned on the sheet. And I know that's what everybody wants to hear about. So this is just the numbers from this latest year in terms of what doctors make as like their total compensation pay. So you can see that primary care providers, which is PCPs, that's like if you just go to your general doctor, pediatrician, kind of that first line of defense, the main person that you see, they make on average $242,000. Specialists make on average $344,000. And then you can see it broken down by a lot of specialties. But one thing to keep in mind is that, and I'll talk a little more about this, but first of all, there's a big delay in how long it takes to get to that type of salary. And there's also a big investment on the front end. So med school is expensive. There's just no way around that. The vast majority of medical schools cost a lot of money to go to. And this is actually taken from a student's breakdown of their costs. And this is actually my cost. This student is me. So I took this directly, just straight screenshotted it from my little internal portal page. And this shows what the school estimates before any scholarships or anything else that it's going to cost for the year. So you can see that just tuition and fees alone are over $60,000. And then when you add in cost of living and other stuff, it's close to $80,000 a year. And this is not at all atypical for a private med school or a med school that you go to that's out of state. If you're going to your in-state public medical school, it might be a little bit cheaper. But this is really pretty in line with what everybody's going to be paying. And to be honest, there are some schools where it's even more money than this. So it's a lot of money. And there's some scholarship and stuff like that available. But to be honest, for the most part, most students end up taking out a lot of debt. So that's just something to keep in mind. It's a big investment on the front end, and that debt will often take quite a while to pay off. And then I was just going to highlight this. So keep in mind, and I'll talk a little bit about this in just 1 second. So for like plastic surgery, say, which this year ended up being the highest paid specialty, I mean, that's a lot of money, I think, for everybody, right?
Yeah.
But it's a long road to get there. And in general, the more the more high paying a specialty is, the more competitive it is to get into, and also the longer the career path is. So I'll just briefly touch on the path to becoming a doctor before I open it up to whatever other questions you guys have. But in general, so you need to go to a undergrad college first for 4 years, and that you do actually have to get a bachelor's degree. It didn't used to be that way. You used to actually be able to just do your prereqs and then go right to medical school in some cases, but now they do require that you have a full bachelor's degree before you can even begin medical school. And then you need to apply and get into medical school, and medical schools are 4 years in general. MCW is actually, there are 2 regional campuses. This is kind of a side note, but there are 2 regional campuses at MCW that are only 3 years. So there's one in Milwaukee and one in like central Wisconsin. And the reason that those exist is they're really more focused on preparing doctors to practice in primary care in like more rural and underserved settings in Wisconsin. So just being kind of like a general family medicine doctor in a more rural area. And that's why the school can be shorter, because you don't do as many rotations through all the different specialties. So that's not me. I'm going to the main campus and I'm doing the traditional 4-year program. But I do know some people actually at those campuses. So if you guys have specific questions about that, I'd be happy to answer those as best I can and put you in touch with people if I need to. And then after medical school, you have what's called residency. So this is where you kind of specialize. You start to learn about specifically what you want to do. So this could be when you start learning about how to be a surgeon, or you start learning how to be a dermatologist or what have you. And this can be anywhere from 3 to 7 years. So like just a medicine's residency is like 3 years. If you want to do neurosurgery, so become a brain surgeon, that's 7 years. So that's a long time. And during this time, you're often working 80 hours a week. So it's a lot of time and a lot of hours to get there. And then you can also often do fellowships on top of that. So if you wanted to be, say, a cardiologist, you would first do an internal medicine residency for 3 years. And then after that, you would have to do a fellowship in cardiology, which is a further 3 years. And actually, even after that, if you wanted to be an interventional cardiology or an electrophysiologist, it's called, there's a further fellowship on top of that. So it can end up being a lot of time that's training. I mean, this is all after already doing 4 years of college and 4 years of medical school, right? That you could be looking at 6, 7, 8 years for different specialties. So it's a lot of time in training. And you are collecting a salary during this time in residency and fellowship. So you're not paying like you were in med school, but it's usually kind of a fairly modest salary. I mean, it's still good money in the sense that it's enough to live off of. But when you take into account how much debt you had and the fact that, for a lot of people, you might be starting a family at this point, while you're in residency, it can be expensive. So yeah, just to take a look at that in a little more depth, just briefly. So I mentioned, that last slide, that plastic surgeon, right, making a lot of money. I mean, and that is a lot of money for anybody. But if you just think about kind of the whole process, it's a long road. So you're finishing high school, then say you graduate college at 22. Most people now don't start med school right after college, or at least the average age to matriculate is 24. But say you just take a gap year between college and med school to figure out what you want to do and to strengthen your application, which is becoming more and more necessary. Maybe you enter med school at 23, finish at 27, and then you have to do a general surgery residency. And a lot of those include research years, which is time that's dedicated to research. And that's the case at a lot of more academic residencies that are the competitive ones that would allow you to then be competitive for plastic surgery. And then you have that 3-year plastic surgery fellowship on top of that. So this is just an example of what it could look like for one path. And of course, there are certain things that can make it a little bit shorter, a little bit longer. But you see that you're not actually going to be in practice starting to make kind of your real money until you're 36 years old. So, I mean, at that point, you could easily, you might be starting a family. You might have a 10-year-old kid at that point. And keep in mind that a lot of the hours that you're working, when you're going to be working the absolute hardest, when you're going to be working 80 hours a week as a general surgery resident, those are going to be in your late 20s, early 30s, which, is a time where people are dating, trying to find a partner, starting a family, having kids, getting married, things like that. So it is a big commitment. And during that time, you still have your debt, which is collecting interest. And that's just the average debt. Some people will have more or less, and you're working all those hours. So I guess that's just to say that as cool as medicine is, and yes, that money's there and it is a lot for certain specialties. And all doctors, I think, will end up being financially okay. It just doesn't make sense, guys, to do it just for the money. Because if you don't love it, it won't matter when you're missing people's birthdays and stuff, working 80 hours a week in a job you don't like. It won't get you through.
Yeah, that's so important to point out, because after what you were just saying, I was thinking you have to really love what you do, because that's a lot of dedication.
Mm-hmm. Yeah, I think that's right. And again, it's the rewards are there, I think, in terms of, and it's not like that whole training time is all time. That's, most of that time, like I said, there's really only the 2 years of pure like med school classes. And then after that, most of it is hands-on experience, right? So you get to do cool stuff. You get to start working with patients and doing the things that presumably made you want to get into medicine. But it is a long time of training before you're finally completely independent and able to be there. So it's a lot of delayed gratification. And that's just kind of how it is. And then I just briefly put this slide in, and then I'll take any questions. But this is just a little bit about what it looks like to get into med school. If any of you guys decide to apply to medical school, I guess, I'm not sure what year you guys are in high school, but presumably, 4, 5, 6 years down the road or longer if you take gap years. This is what it looks like this year. For you guys, it'll be even tougher. It just will be. I mean, it's getting tougher and tougher every year. It's more and more competitive. It was more competitive for me than it was for people 10 years ago. And it'll be more competitive for you guys to get in, barring something unforeseen, than it was for me. So really,
why is that?
It's a good question. I think the main reason is just that because there's not the number of physician spots that are available is just a lot. The number of jobs that are available and the number of physicians that are graduating every year is a lot less than the number of people who would like to go to medical school. It's tough to say why it's always getting more competitive. I think some of the reasons are good, to be honest. I think one of the reasons it's getting more competitive is because med schools are making a real push to open the process up to more and more people. I think there are just more and more competitive applicants than there ever have been. It used to be honest, that medicine was something that was kind of for white men. And obviously I'm a white man, but the vast majority of my class is not. Now med schools are more female than they are male on average. And there's more and more diverse classes. Which is awesome. And I think we're just pulling amazing people from more and more backgrounds. And I think, more and more people are seeing that it's a cool career and a career where that, it still can provide a good living. And I think it's still a respected career. But yeah, it is just getting more and more competitive. As you guys go into college, if you take like a Gen Chem class, they might do this. They did it for me. They have everybody raise their hand at the start. And they ask like, who in here is thinking about going to med school, applying to med school, being pre-med? And people will raise their hand, and then they'll say something like, okay, 1 out of 5 or 1 out of 6 of you guys will end up actually going to med school. And that's in large part just because a lot of people change their mind. They realize it's not for them. But you'll realize that as you get into college, a lot of people really think that medicine is for them and kind of start off on that path. Some decide it's not, some kind of keep going towards the end. But here, even you can see from this last year, this was a little bit of an especially competitive year to get in because of COVID and some other factors. But this year, just over a third of people who applied to medical school. So they went all the way through, did all the prereqs, took the exam, and applied to medical schools. Only about a third of them got into a single med school and were able to matriculate. I mean, that is competitive, but I would argue that it's a good thing to have that competition on the front end, because the good news is what that means is that everybody who gets into a med school in the US, for the most part, should be able to secure a residency. So if you get into med school, you'll have a residency afterwards, and that residency will then set you up for a good job as a doctor. Now, some types of residencies are more competitive than others. Not everybody can, and not everybody can work at Mayo Clinic or places like that. So depending on where you want to train, it's more competitive. But pretty much there's a residency for every US graduate. And I will say too that these numbers don't include DO schools. So DO is Doctor of Osteopathy. So my school is what's called, MCW is a traditional allopathic medical school, it's called. So it grants the MD degree. There's also schools that grant the DO degree. And in general, DO schools tend to be slightly less competitive to get into med than MD schools, than traditional medical schools. That said, though, people who graduate from DO schools have the exact same training and match to the exact same residencies, and they're just as capable of doctors. However, it tends to be a path that maybe is better if you're interested in something more primary care like, because it can be a little bit tougher if you're coming from a DO school to match into like certain specialties. It just, the focus is more on primary care. It's not impossible at all, but it's a little bit tougher if you decide you want to be a neurosurgeon to do it from a DO school. But these numbers don't incorporate that. So if you were to add in the number of students, probably most of these students who applied to medical schools, some of them also applied to DO schools. So if you added in the DO school factor, this number would be a little bit higher. But it's still difficult every year. A lot of people apply and don't get in. A lot of people then reapply and get in afterwards. So certainly it's not something to, think that life is over if you don't get on your first try. A lot of people, I've got classmates who applied multiple times and were really determined. And oftentimes schools like that because it shows a lot of perseverance and they keep getting more and more experience. But it's a process to get in. But I think it's certainly something that is doable. And these are some like the big factors that they take into account. But the good news is everybody's going to have certain things that they're stronger on. You don't have to be amazing at everything. I did not have an amazing GPA in college. My GPA was a lot lower than this average accepted GPA to get in. And my clinical experience, I had some clinical experience, but it wasn't as much as a lot of my classmates who did absolutely amazing things. But then I had really strong research because that's one thing that I focused on. So maybe that's one thing that I think caught, my medical school's eye. So I guess all this is just to say, you do need to check some boxes when you're thinking about medical school. There's some things that everybody wants. but you don't need to check all the boxes in terms of being the very top and everything. You want to be yourself, and you want to kind of find things that you are passionate about, and schools will respect that a lot too.
Mm.
So that's kind of the big message I had, but I'm happy to answer any questions. And if you guys want, feel free to take down my email. And anytime you guys have questions after this, or if there's a question you just don't want to ask, I'm really happy to answer anything. And I can answer over email, or we could even set something up if you ever want to chat outside of this too. I'm happy to
Nice.
talk.
Well, thank you for that offer. A lot of our students, they're in high school. What are some classes that you think would be beneficial for them to start like really focusing on so that when they get into college, they could be more successful?
Yeah. So I'd say that, to be honest, really in high school, I really wouldn't worry too much. Obviously if you're finding your science classes are things that you guys like, that might be a sign that, like, hey, when I get to college, I'll take more science classes. If you're doing well in science, you like science, most of medical classes, a lot of your pre-med classes and all your classes in med school will be science-based classes, right? So if you find you really like science, that'd be something that I'd maybe be thinking about and being like, oh, maybe I should consider medicine more. But you certainly don't have to be taking any specific classes when you're in high school. If you guys want to take something like AP Bio, AP Chem, just so that you don't have to take it in college, that's okay. But to be honest, it's totally optional. And some colleges will even want you to take it again in college. And some med schools, there's a limit to how much you can get away with taking a bunch of like advanced classes in undergrad. I know some med schools prefer to see like certain bio classes and stuff actually taken in a college setting, as opposed to just AP classes. So really at this point, I would not be worrying about trying to get ahead too much. There's only so much you can do in high school to really get ahead. I'd be more just focused on seeing if this is something you actually want. And if you think it is something you guys might want to do, maybe go volunteer or something, go to a hospital. I know when I was in high school over some summers, I did volunteering at the VA hospital back in Minneapolis, and I was just a patient transporter. So I wasn't doing anything medical. I was just pushing patients who were in wheelchairs or beds around the hospital. But I loved it. It was a great experience. I got to meet some of the nurses and a few of the doctors, but I mostly just loved getting to meet the patients, interacting with their families, and just kind of seeing how a hospital runs, just getting the feel of what it's like to be in a hospital. And that's really when I first started thinking seriously about maybe I'll be interested in doing medicine one day. So yeah, that's what I would say to focus on right now. Guys, you'll always meet people who are like more or less knowing what they want to do at a young age, but there are a lot of people who decide they want to go to medical school when they're already, midway through college, or people like me who wasn't even sure even after I graduated college that it was what I definitely wanted to do. So you have plenty of time to figure it out. I would just say start getting exposed is the main thing.
Nice. Good advice. I was just going to ask you too, because you just mentioned that when you were volunteering, you found yourself like really, you just wanted to help people. And so what are some of the skills that you think would be useful for this type of career?
So in terms of skills, I think that it's kind of funny, right? Because some of the skills that you're going to need the most as a doctor are not really the skills that you need to become a doctor, if that makes sense. The skills that it takes to get into medical school, a lot of it, to be honest, is going to come down to academic record, in part because that is important, because they need to know you can handle the med school classwork. Also, just because that's like the one thing that they have that it's easy to sort everybody on, right? Like everybody has a GPA is like a solid number, and test scores, especially that are like standardized, everybody takes the same MCAT. That number means the same thing, no matter who you are or why you take it. So I'd say, your academic skills are important, but when you actually get into medical school, I'd say, and even beforehand, when you're trying to get letters of recommendation, when you're trying to make connections, when you're volunteering and stuff like that, I'd say really people skills are super important. I mean, this is a interpersonal profession, and there are some types of doctors that have less patient interaction. Like if you're, say, a radiologist, then you're mostly going to be reading slides, like in a basement, and you won't see patients that much. You'll still have to see them occasionally. You'll still have to work with colleagues and stuff. But if you're just like a normal doctor who's seeing patients all day, I'd say the biggest thing that makes somebody a good doctor is somebody who's able to listen, to empathize, to understand the concerns of their patient. And medical schools are working really hard to try to put more and more emphasis that aspect of your application, showing that you are somebody who's, the holistic aspect. And that actually, for college, I think that's kind of just a buzzword. I think for med school, it actually does matter, because you could have a 4.0 GPA and a perfect test score, but those people get rejected every year if they don't have any experience, and if they haven't shown that they're able to be good talkers, good communicators.
Nice. That's very important for sure. So, Simon, we have a couple of
Mhm.
questions in the chat. So, the first one is, does it matter what undergrad college you go to in order to get into medical school easier? Do you have to go to like a prestigious school for undergrad in order to get into medical school?
So the answer of doesn't matter at all
Mhm.
is yes. The answer of like doesn't matter much is no. So it matters a tiny bit where you go to for undergrad, I think. And even then it can vary. It's tricky and I wouldn't want to lead you astray, but I think in general, so at my medical school, for instance, we have people who went to just, local state schools, very good schools, but like local, regional UW campuses, UW La Crosse, UW Stout, places like that. We have people in my class who went to Harvard and Columbia and Washington University, like very prestigious schools. So to be honest, I don't really think it matters. I think the one thing that maybe does matter is if you do go to a very like a notoriously tough school that is very difficult, like MIT, is famous for like grade deflation. So if you go there, they might take into account that when they're evaluating your GPA because you're taking, supposedly more rigorous classes. But just because you go to a local state school, a school that's a good financial option, it doesn't matter. And people from those schools get in everywhere in the country. I will say that the one thing that is a little bit different is I think most med schools like people to go to 4-year schools and not community colleges. I love community colleges. A bunch of my friends go to community colleges. I thought about going to community college to get like some generals done. And I think that if you just like get some generals done there, depending on the school, they might be okay with it.
Mhm.
But I'd look into that a little bit more because I know that a lot of times they do want to see that for like, especially your advanced classes, that you are taking them at a full 4-year university.
Okay, that's good information to know. Really good question. Another question we have is that they were told that now with COVID and everything, that there's a high demand for a lot of medical positions. Have you ever heard of that? And what do you think that it will be in the coming years, the projection of it? I think it's going to continue to be a high demand.
Yeah, it's a good question. I mean, so because of COVID, I think that obviously the COVID probably won't be impacting it too much going forward. But just in general, I mean, the number of doctors that are needed is expected to increase quite a bit, and also other medical professionals, right? Like healthcare is one of the fastest growing sectors. Today I was just talking mostly about medical school, but there are lots of cool jobs and careers within the medical field. There's physician assistants, there's nurses, obviously, there's EMTs, there's all sorts of different, technicians, all sorts of different things you can do in the medical field. In general, though, I think that yes, the number of doctors that are needed is expected to increase. One of the nice things about medicine is it kind of has to always be there, right? Like doctors in some form, it's one of the, it's one of the oldest professions that's ever been around. They're like healer of some type is, one of the oldest professions, and it's always going to be. And because people get sick at all times, medicine compared to maybe some other fields tends to be a little bit more recession proof and things like that, because even when there's even when companies are losing value and whatever else, people still get sick, people still need to go to the doctor. And I know for a lot of fields right now, I would say it's potentially a good time to be coming into medicine because we have a lot of baby boomers, that generation that's getting older and older, and it's going to need more care. And a lot of docs are at the point right now where they're going to be retiring. So I'd say, yeah, it's job prospects are always good. And kind of like I said, the nice thing is that the big barrier to entry is kind of on the front end in terms of getting into a medical school. But then once you get into a medical school, in general, there's never really an unemployment problem with doctors. You might be limited if you're in a very specific thing to certain areas. It might be tough to find a job, especially in like big desirable cities like New York City or Boston or San Francisco.
Mhm.
They can sometimes have a lot of doctors that drive down compensation, and it can be tougher to find a job. But in general, the job market for doctors is always pretty good.
Yeah, I can see that. Well, cool. Thank you so much for your time. I
Mhm.
know You are very busy, so this has been very informational, and I think we will take a lot away from what we've learned today. Students, do you have any more questions for Simon before we sign off? Really good questions we have today. I have one question for you. So with all this dedication and everything that you're going through with the schooling, what is one thing that you don't like about it? And what are some things that you do like about it
Sure. Something I don't like.
besides all the studying?
Yeah. Yeah, I guess one thing that I maybe it's not so much I don't like it. I guess I kind of miss having taken time off to work before I started med school, like just kind of like a normal job. Yeah, it was like a research job, so it was an academic setting, but it's still just like a normal job.
Mhm.
I definitely miss some of the flexibility that comes with that. And also just, it's not bad to have like a job, to be making money, to have responsibility, to have some control over your life. And, you kind of feel like an adult. It's tough sometimes to go back to being a student and being on other people's schedules and
Mhm.
stuff like that. And I'd also say, it's tough sometimes. I like my classes, but it's tough to be during these first 2 years sometimes to stay motivated because you really want to just most people who are doing medicine, right? They want to be working with patients. So it can be tough when you do all like this patient care and stuff and get clinical experience, and then you get into med school and then you kind of go right back to the classroom.
Mhm.
But the nice thing, and going to like something I like, one of the nice things that's that even within those first 2 years that are more preclinical before you actually end up being in the hospital all the time, there are so many opportunities to get more time actually with patients. And that definitely helps remind you like why you're doing what you're doing. So you can shadow, and it's so easy to shadow once you're in med school to work with different doctors in the clinic. You can volunteer. There's like student run clinics that we've got at our school that are awesome. So there's a lot of different ways to stay involved.
Very cool. Well, thank you for that.
Mhm.
All right. Thank you again for your time and thank you for your contact info. So yeah, if students, if you have any questions down the line, if you want to ask, feel free to reach out to Simon. So thank you for that as well.
Yeah.
Well, that's it, everyone. Thank you and have a good afternoon.
Thanks, everyone.
All right. Bye.